exactly this is targeted to. But when we talk about ensuring that medical rights are recognized, what exactly are we speaking of here?
Thank you, Ndu and Dennis and viewers. Article 43 of the Constitution of Kenya says that every person in this country got the right to the highest attainable standard of health. Mm-hmm. As if that was not enough, the Constitution also says that nobody should be denied the right to emergency medical treatment. Mm-hmm. And I think that is very forceful a statement which is now immortalized in our Bill of Rights in the Constitution of Kenya 2010. And today, of course, our Constitution is going to do another anniversary. Mm. What some people think, there are people who philosophize, there are people who want to theorize that and say, you know, the right to the highest attainable standard of health is a second generation right, is a third generation right. It should only be available when the state got resources. But more progressive thinking, and I think that is the right thinking that we need to adopt as a nation, is that where we are today as a country, every person got a right to the highest attainable standard of health. That is to say, if you visited your closest dispensary, mm-hmm. you should be able to go through the necessary clinical diagnosis. You should be able to find a competent nurse. You should be able to find a competent medic. And after you've been given the right diagnosis, you should be able to proceed on the right prognosis. That is to say, you should be able to proceed on the right treatment. Mm. Certainly, this is not what is happening in this country, because if you were to visit your local dispensary, you would find that there is no medic. Nurses are on strike, and the facility is closed. That is contrary to Article 43 of the Constitution of Kenya, which makes it now to be a fundamental right and freedom to be able to be diagnosed in the nearest medical facility and at the government expense. And diagnosis alone is not sufficient. Mm. You should get the proper treatment, the proper prognosis. For a number of times now, I've seen counties where the medical facilities have been shut down because either they can't agree with nurses, they cannot agree with laboratory technicians, they cannot agree with clinical officers, they cannot agree with the doctors. This is so sad in a country where many people are putting up under $1. That is to say, we have people who are fairly poor in this country, that they would barely afford 1 square meal a day. So you go to the hospital and you find a public hospital is shut down. The only other option that you would have is to resort to herbal medicine. And the danger now that we have with herbs as a country is that so many people have ruptured their kidneys, so many people have burned their liver. We are losing so many people because of organ failure, because of resource